October is known for many things, including Breast Cancer Awareness Month. And joining me today is Dr. Bradley Beeler of Ballad Health to talk about some of the signs and symptoms and why raising awareness goes beyond the month of October. Thanks so much for being here today.
Yeah, thank you so much for having me. Pleasure to be here.
Let's go ahead and just get straight into it. How early should folks start thinking about detecting for breast cancer?
I think it's important to be vigilant about anything, any changes that you may be experiencing, something, a lump, a bump, something like that, something changed. It's always important to be vigilant. Most average risk individuals, we start screening at 40, and other individuals, talk to your doctor. There are some risk factors that you may have. There may be some genetic predispositions that would warrant screening perhaps a little bit earlier.
And I know that you just talked about a couple of different things, but what are some signs and symptoms people should really look out for, and how can they do those self-checks at home ahead of going to the doctor?
Right, I think it's important to be attuned to your body for those things, right? So not everybody's the same, everybody's a little bit different in some contexts, but looking for subtleties, you know, things that are changing. Is there discharge? Is there new dimpling? Is there new bumps? Things like that. Those are some minor things that you can catch and come be seen. And, you know, I think we've all been impacted by breast cancer in some capacity. You know, it's a very common entity, unfortunately. 1 out of 8 females are impacted with it in the U.S. and globally over 300,000 this year alone. So I think being attuned to your body, being attuned to the systems, but understanding that screening protocols are in place to help individuals. And we don't just do screening to detect it, right? We have to do it to make sure that there's a benefit there. And there is a breast cancer mortality benefit there. And it's really about a relative risk reduction of about 25%. And what does that mean? So when we think about those cases, if you think about 1,000 mammograms starting at the age of 40, those are 8 lives that are saved from breast cancer alone. So I think that's an important factor about screening.
Absolutely. And speaking of that, let's talk a little bit about why early detection is so important if you do get that news that you have it.
Right. It's devastating news to hear, right? And I think it's very intimate for each individual when they hear those words, and those are important things. The good news in all this is that when we detect breast cancer at an early stage, right, we can intervene upon it earlier. And folks that have localized disease, we catch this on screening mammography. There's something that can be done about it. And the good news is the overall survival for those individuals is typically above 95, even 99% in most instances.
Yeah, those are some great statistics there. And where should someone start when it comes to checking and getting treatment? Do they just start with their regular doctor, or where should they go?
Yeah, absolutely. Go to your regular doctor, your family practitioner doctor, internal medicine, family practice, something, anybody, and they'll be able to streamline to get you help, get you seen. We can see those patients too, so we're always happy to accommodate. So if there's something that's wrong, something doesn't feel right, it's too easy to get the screening done.
We know there's always things that are out there in the world that talk about ways you can prevent this and prevent that. Are there any true ways to prevent getting breast cancer?
I think the best things that we see is a healthy lifestyle, truly. So good diet, good exercise, those things really do go a long way. But in terms of preventing, I think it's important to be able to know what your family history is, being able to get that early detection. Those things matter, but having a well-balanced diet, exercise, those things are probably the most helpful things.
Absolutely. Well, thank you so much for joining us today, of course, to talk about this incredibly important topic. We appreciate it.
Thank you, guys.
Well, plenty of other news coming up here.